to see those numbers 321. And we are live. Good morning in Israel and good afternoon in Australia. I am always so happy to be here with my co-host, Rose Hoy from Melbourne. Good morning. Good afternoon, Rose. Good to see you.
Good afternoon, Tova. You know, today we've got someone from Melbourne. We don't often have people from Melbourne, but I've known of Dr. Craig Hassed for many, many years. He's been promoting mind-body medicine in his own way, and besides all the previous, Dr. Sano people, he's been one of the advocates here. Now, he also has written several books on mindfulness. He's also, and I've put that up on our little advertisement if anyone wants to buy it. And he's also been in 2 movies. Craig, what's the name of the movie again? I can't remember.
The first one, and these are 2 documentaries made by a documentary maker, Shannon Harvey. And the first one was The Connection. So it was a documentary all about the mind-body connection, and a lot of rock stars of the mind-body medicine world on that. So John Kabat-Zinn and so that whole bunch of people that would be very interested. And the second one was My Year of Living Mindfully. And again, so some real rock stars of the mind, body, and mindfulness area in that as well.
Yes, it must be a good 20 years or 15 years ago since I originally heard Dr. Hassed talking about mindfulness, and he was so impressive that as the time has rolled on, I wanted to bring him on. And now that our times are more suitable to Aussies, we've requested him to come and speak. Now, many of our TMS patients or that watch us know about mindfulness but can't achieve it. Can you just sort of draw the line between wanting to do it and have that awareness, and what would the process be to get them? Because most patients will say that their minds are racing and they can't undo that racing. So would you be able to draw on that a little bit more and give them some idea of how they can achieve that?
Well, if that situation is experienced by somebody, I think one of the very good places to start is to stop worrying about the mind racing. The mind can be running around sometimes like a dog with a ball in its mouth, and it's running all over the place, all over the park. And we think, I've got to run after the dog, I've got to stop it running around and so on. And you know, that the more you chase a dog with a ball in its mouth, the more it runs away from you, and it's tremendously frustrating and exhausting. And if we could just get the idea that we're doing something wrong or it shouldn't be happening, and just adopt the idea that the mind's just doing what the mind does. But if we can just learn to sit on the park bench and just watch, and if it's running around, but just learning not to get involved, not drawn into it. Just practicing learning to let those thoughts come and go without even thinking they shouldn't be there. And we might find that there's a greater sense of peacefulness, even though the mind's still active. And mind you, as you know, if you sit on a park bench for a little while, eventually the dog comes along and drops the ball at your feet. So if you're lucky, that happens, but not because we're trying to run after the mind or get into a battle with it, because that's a very, very common experience, the mind running around. If we could just stop criticizing or judging or even thinking it shouldn't be happening, then it makes the whole process a lot easier. And I think one of the other things that's really important is to remember that mindfulness is not just sitting in a chair practicing some meditation. It's also a way of living. And if we can just get the sense of learning to be more mindful in day-to-day life, just being in the present moment. That means when you're eating your food, just to taste the food. It means when you're walking down the street, rather than walking down the street and worrying and ruminating, it means just be physically in the moment, just walking down the street, just feeling the breeze in your face, just the sound of the birds singing, just feeling the sun on your skin, whatever it might be. Just so if we can learn to live in a more mindful way, more in the moment, and less anxious about the future and etc., then again, it makes the process a whole lot easier as well.
So I'm just going to play the devil's advocate a little bit. So yes, I know that I need to accept my thoughts, but they keep coming at me. It's like they're it's like this voice. Like, how can I shut it up? How can I take it away? Like, well, it's more like, I think what people need to hear is that it's possible to literally watch your thoughts, calm your thoughts, and not get attached to them. So if you could talk a little bit about that. And when you say it's like a habit, someone has to learn the skill of being with their thoughts. Can you share about that? Because that's probably something you teach, like how to do that.
Well, non-attachment's a very important part of practicing mindfulness. So if there's a thought that comes in, like an opinion, as we say, to hold an opinion, well, that implies that there's a really strong attachment that we have to the opinion, to the idea. But just letting go of the attachment to the thought, the attachment to the emotions or feelings, the memories of the day that's just gone, the worries about tomorrow. So just learn to, in a sense, stand back from it. There's perhaps a very important distinction between trying to control the thoughts and the feelings compared to standing back from them and not being controlled by them. Just an impartial observer of them. Now, the thing about how can we stop the mind thinking? Well, then it means not only is the mind thinking about, whatever it's thinking about, I've got this work to do, I've got this all to do before the end of the week, etc. But now there's another layer of thinking about, why can't I stop thinking about all this stuff? And
That's
the mind
true.
starts with a conversation of what's wrong with me. I wish I could be better at mindfulness because it seems like a good thing to do, and maybe I'm not cut out for it. And so if we can just sort of, in a sense, stop criticizing, just accepting, just being a little bit gentler with ourselves, a little bit of self-kindness, it's okay. They're not judging what's being noticed. Then all of a sudden it's just a thought, but without all the elaboration about it. It gets easier. And mind you, it takes a little bit of time, but it gets easier just to observe, but without the involvement in the thinking. If we do that, we might find that the thinking process quietens down by itself. But paradoxically, the less we try to do, the easier the process is. And so kind of, in a sense, I suppose it just sneaks up on us. But it's but if we get caught up in a conversation with ourselves about what's wrong with me, why can't I stop my mind thinking, and I wish I was better at this, we're just going to be going around and around and around for a very long time.
Well, that's right. The other thing that occurred to me is restlessness. That idea that restlessness is going to also, I was thinking of the park bench and thinking about someone sitting down to rest. And in that moment, that restlessness comes and they've got to do something. And you actually alluded to it just before about just being an observer of yourself. But would you talk about that that ability to stop that restlessness as well as the mind racing? Well,
you see, the movement in the mind, thinking, feeling, emotions, attitudes, reactions. So that's being observed, but there's an observer of it. If we get drawn into it, caught up in it, attached to it, etc., then all of a sudden we feel moved by it. We feel agitated by it. There might be restlessness in the mind, but all of a sudden we feel restless. If we can just observe it, and even if the mind's very busy, it's just observing the mind being busy. The mind reliving the past, just noticing, just mind reliving the past. But we learn to just ground ourselves back in the present moment. The body's here now, just in touch, back again with the senses. Then, and this is what's meant by the term coming to our senses, mind you. If we can learn to do that.
Coming to our senses is very, very important.
Tova, can you write that in on the sidebar?
Coming to our senses. Go ahead. I didn't mean to interrupt. Continue.
Yeah. Well, you see, there's a term given to this mode of mind we go into when we're not mindful. When the mind's talking to itself, when it's living in a future that hasn't happened, when it's reliving a past that's already come and gone. So the term for that is called default mode or default mental activity. It's the distracted mode of mind we go into, and the attention circuits are offline, the sensory circuits of the brain have disengaged, and the mind's just wandering off by itself, talking to itself, worrying, reliving, ruminating, etc. That's why there's a lot of this default mental activity in states like stress and anxiety and depression. And what we know is that as soon as you come back to the present moment, especially through the senses, it switches off all of that default thinking. So there you are, you're making a cup of tea and you've got a tea bag in the teacup, and while your mind's having a conversation with itself about how am I going to get through all of these deadlines in the next few days, how am I going to do this, how am I going to do that, oh, what that person said to me yesterday. So all of a sudden the mind's doing all of this, but you observe it. Oh, there's the mind talking to itself. There's the mind imagining a future that hasn't happened or reliving the past. And you come back to just feeling the tea bag and the teacup. You come back to just being in the kitchen you're in. It's coming to your senses. All of a sudden you're seeing, hearing, feeling, tasting, touching, so it's and it helps to switch off this busyness of the mind. Not so much because we're suppressing it, as we've just shifted our attention back to present moment reality, as it were. Yes. Simple but profound.
Yeah. And as you spoke, I thought we're using our senses, our hearing, our sight, our smell. We're using all those senses to bring us into the present moment, aren't we?
Yes, any of the senses can be used. In mindfulness meditation, most often use the sense of touch, but any sense could be used.
Yeah.
Would it be also like because we've learned a lot from our studies, to have somebody focus on the breath, which is it's not one of their senses, but it is a place that can calm people because of the parasympathetic nervous system. So wouldn't that be in there as well? As the breath is a natural sense.
Well, you are using the sense of touch. You're feeling the sensation of the breath as it enters and leaves, whether you're breathing through the nose or the mouth, but you're just feeling the actual sensation of the breath. And so it is coming to your senses, but the breath is a very tangible, very, very useful resting point for the attention. I kind of use that term resting point for the attention, perhaps in one way rather than focal point, because very often when people think, oh, I've got to focus, all of a sudden it becomes the hard work of trying to focus rather than just learning to let the attention rest with the breath. And if it wanders off, you're just allowed to come back and rest with the breath once again. So we get a sense of we're not trying to force or impose, but just allowing the attention to rest where we would like it to be. During the meditation, it might be with the breath. But in day-to-day life, when somebody's speaking to you, just rest with the sound of their voice. You just pay attention to what you're seeing. When you're eating your food, you just taste your food. If you're having a coffee in the morning, I'm not a coffee drinker, but I know how much coffee drinkers love their coffee. Just smell that smell of the coffee.
So you said allow your attention to rest.
Yeah.
I love that.
That's right. Because many people find focusing hard work if they're trying to do it in a way, firstly, that they're trying to force the attention to stay somewhere and getting irritated when it wanders off. And secondly, and this is an interesting little experiment that people can do, is that when we're trying to get rid of a distraction, like if, for example, I invite you now and everybody who's on this call now to just notice some reasonably persistent sound in the background, and then I ask you to block out that sound so that you can't hear it, like mentally make it go away. And of course, the harder a person tries to make that sound go away, the more the attention actually goes to it. So it becomes a much more influential distractor. And so if you're trying to make your thoughts going away, what we actually do is we become hypervigilant for the very thing we're trying to get rid of. Now, mind you, this also matters for pain. So if the person's trying to get rid of the pain, make it go away, the person's actually becoming hypervigilant for the pain, and especially if they're becoming emotionally reactive to it, then all of a sudden the sensation dominates the attention, the amount of suffering associated with it escalates enormously. So wind it the other way. If a person can learn to just notice that that sensation is there, but also just notice the environment they're in, what's going on around them, the thing that they're eating, etc. So if they can just engage their attention back with that and just let the other thing be there, and get less reactive emotionally to what we're not liking. So if we can just learn to just feel more gentle with it and just allowing it to be there, then we might find that it undoes that. And all of a sudden, we don't get this escalating effect of hypervigilance, reactivity, increased suffering, more frustration, more dispirited. We can actually go the other way. And that's how mindfulness, one of the key ways it helps people with anything that we find uncomfortable physically or emotionally.
So it brings in the science of self-compassion. If people were more kind to themselves, more compassionate, more patient, then they would move into that mindfulness place easier, which is all becomes chemical at some point.
That's right. And you see, mindfulness is an essential part of compassion, and particularly self-compassion. But self-compassion is an essential part of mindfulness. So those two things, because many people think
they go together, don't they?
It's just about the focus. It's just about the attention, and get frustrated rather than realizing it's attention and attitude. And the attitude matters as much, perhaps even more in some ways, especially when we're dealing with things we find uncomfortable. So that attitude of gentleness, of self-compassion, of non-reactivity, of acceptance, of just, if we can cultivate that attitude with which we're noticing things, even the things we find uncomfortable, it gets so much easier.
And that's where the observation comes in, isn't it? Observing yourself. Yeah.
Yes, and when people start to learn mindfulness, and the research shows that what happens first is the awareness increases. So the person starts to notice more than they were noticing before. But the attitude takes longer to change, from judging and criticizing and reacting, etc., and self-criticism. So the attitude changing 180 degrees to gentleness and self-compassion and so on, that takes longer. The attention tends to mature first. The attitude, that takes a little bit longer. And so we should be just a little bit more patient when we're learning mindfulness. We should also get some instruction from somebody whose experience can help us through those kinds of difficulties when we meet them.
I don't know why I thought about this. I thought, the whole world does things to help them be calm and relaxing. They take drugs, they do all sorts of things that try to do that to the brain. And we begin to think, I need that for me, whether it's a cigarette or whether it's the cocaine or whether it's the drug. And if I were taught in first grade that I have this chemical inside of me to relax. I mean, I don't know, it was a show where we talked about that what cocaine gives you is something we have inside of us. What cocaine gives us, we have that ability. And so here we are talking to you and understanding that we're born with all these amazing abilities to learn this. And I think we've not been educated properly. It's not anyone's fault. We're not here to blame anyone, but we do have this ability. Each person can do this on their own. And you're saying it, science. It's in our brain.
Well, he's not actually, because he's actually saying it takes a while. And that's what an important thing, that it takes a while. The awareness is there, but you also have to have that compassion. And that doesn't always come easily for people with somatic pain. So patience, it might be 6 months, it might be a week, or it might be a year. But watching yourself and being aware is what Dr. Hassed is talking about. The fact that awareness has to be there constantly so that the other part of your mind can let go. Would that be the right way of phrasing it? Because the awareness...
way of expressing it. I think one of the other important aspects of being mindful is kind of curiosity in a way, to get interested, and to observe in a curious way means to notice not to criticize, for example, when we get reactive to pain or anything we find uncomfortable, or to our own stress, and to sort of notice that it escalates it, is not to judge or to criticize that, oh, I'm so bad, why do I get it wrong, is rather, that's interesting. I think that's interesting is a lot more useful than that's terrible or what's wrong with me.
Yeah.
Like, that's
Well,
interesting. Because
I often
if we have that interested attitude, then we can learn from our experience, even the experiences we think are wrong or not getting it right. We can learn from that experience, and then we can move forward with greater wisdom and understanding. Because, in coming back to the point that you were making before, Tova, is that we want to learn the underlying causes of things. Why are we activating that stress response? Why have we gotten into this cycle of attitude or behavior, etc.? And we do, and we can try and take something to numb that, to cover it over. But if that pill, that drug, is just covering over the surface, and we're not getting to the underlying issues and understanding that, it's going to keep on coming up. And we're not going to get that deep and lasting relief that we need. And we have to have, in a sense, a kind of a wisdom and an insight and making conscious decisions, etc. But curiosity, getting interested, noticing will teach us that. Criticizing doesn't, and we can't, in a sense, game the system, and just assume that an upper is going to, because when we try and do it artificially, you get one thing, but you actually get the other side, which is not always so good. And so the drug doesn't lead to the solution in the longer run, which is not to say that there aren't medications that aren't appropriate to use and so on. It's not that, but if we can combine that with understanding, deep understanding ourselves, then it's a much better long-term combination.
I often suggest that people see themselves as having a drone looking down, because the drone doesn't judge, it just looks, just sees, and then be that part of that drone so that you can actually see, because it's almost like turning a ship around, isn't it? A cruise liner around in a short space. You've got to do a complete turnaround of your thoughts and recognize them as being not you, but an act within you of fear, isn't it? Of fear and it's having a sense of a problem within yourself rather than a problem with your feeling of, your back pain or your leg pain or whatever, but to feeling within you that's I suppose missing, and that mindfulness then builds it. I suppose builds strength in you, doesn't it? I was just thinking about that emptiness that patients have, and then as the mindfulness and the breathing exercises or whatever, that builds that sort of sense of compassion that you're an okay person no matter what.
You know what Rose and I noticed?
Dr. Hassad,
what Rose and I noticed together is, people, they don't like themselves. And so they're having this relationship with their mind and themselves, and they give the mind this power. And then they have this, they don't like their bodies. They don't like the pain. And so we try to help them befriend the pain and not see it as attacking them. So, because I would want maybe you to share is what are some basic insights? I mean, mindfulness might seem, oh, that's for intelligent people or Buddhist. Everyone can access the curiosity that Rose has taught me about for so many years, and the self-compassion. But maybe a tool, if somebody's starting from like, okay, I'm in pain, my body's against me, what would be a basic insight that you might want to help them to break through this sort of ping pong game in their brain?
Well, I think it's maybe to sum up, some of the things we've already hinted at. And mind you, practicing mindfulness for, severe chronic pain is not for the faint-hearted. It really takes quite a lot of courage.
Oh, it does, yes.
Patience and
courage.
It does, but it can teach us an enormous amount. And if we learn the process and work well with it, it can make an enormous difference. And that's what all the research shows as well. But some of the crucial things, that practicing mindfulness for significant chronic pain, etc., is more than just a couple of minutes a day. It's like learning to really sit with the discomfort. But what we were saying before about the non-reactivity to it, initially, like we're increasing awareness. So we will become more aware of sensations in the body. We will become more aware of the reactions or attitudes in the mind and noticing the effect that they have on escalating the pain. So if we can just practice noticing those, but with less reactivity to it, and this is day by day, moment by moment, not trying to fight or suppress them, but learning to just stand back and observe. And like that observer, that sort of drone, I suppose, which is a good metaphor, just watching, just noticing. And we're, in a sense, learning to be calmer with the pain. Shannon Harvey uses a term, discomfortable, learning to be comfortable with discomfort. And it's like that with stress as well. You're stepping out, somebody says, would you come and speak in public? And you have a wave of anxiety and it's like, oh no. And the more you fight it, the more we escalate it. And so paradoxically, learning to be comfortable with the discomfort helps enormously. So we don't get into that spiral of escalation. We can learn to feel. So the amount of suffering associated with the pain, because something we find uncomfortable, like physical pain, and there's nothing particularly to like about it. It has its uses, mind you. It has its uses, but there's nothing. But the pain is there, but the attitudes like fear or anger or frustration can amplify the suffering associated with it enormously. So mindfulness helps us to work in the opposite direction, learning to feel comfortable with the discomfort, learning not to be fixated on it, learning to observe it as a sensation, but without all the mental elaboration about it, all of the thinking, the projecting onto it. And what's the future going to be like? Is it going to be like this forever? Or back into the past? Why wasn't I watching where I was walking and I fell over and hurt my back? And if only I hadn't done that last week, last month, 10 years ago, I'd be all right now. All of that default thinking doesn't get us anywhere particularly useful. So if we can learn to, in a sense, just be with the sensation, nothing more, nothing less, without all of the elaboration, without that amplifying it, then we might find not only do we feel more comfortable and there's less suffering associated with the pain, but there are actually a whole series of changes that happen in the brain as well. Because what's known now from what goes on in the brain is that with chronic pain, there tends to be hypervigilance and emotional reactivity to it. And that sensitizes the pain circuits to fire more pain messages with the same stimulus. So if we can learn to be less fixated on it, less reactive to it, emotionally particularly, then it helps those areas of the brain to just quieten down again. We're not trying to make the sensation go away. If it's there, it's there. But we're learning to be with it in a different way. And that takes a bit of time, especially for strong and chronic pain. So there's the sensation, but then there's what we bring to it. And that's where we can do the work, the internal work. And of course, it's implicit. You've got to do this with the best that modern medicine or healthcare has to offer and so on. But if we can get those two things working together, good healthcare, but also good skills, internal skills, then we can, it's a much better outcome.
Yeah. So in actual fact, as we consider a patient, I just wanted to say before, I have heard Dr. Hassed speaking to patients, and it's just been a wonderful experience, sort of like as a nurse in the background, listening to him speaking to the patients. And those few moments ago, that's the sort of work that I've heard him do, and it's just so beautiful as he actually stills their minds or stills their bodies. And it's my compliments to you. It's just absolutely lovely when I've heard you. Yeah.
One of the things that I think happens in medicine is that so much of the focus is on on what the doctor can do to or for the patient. And we don't often give enough time and attention to helping patients know about what we can do for ourselves. And that's that sort of thinking, there's nothing I can do for myself and it's all over to somebody else to do it for me, can be very disempowering and doesn't necessarily lead to a good outcome. So if the language and if the skills that are taught and so on, helping a person to know that there's an enormous amount that we can do for ourselves, that's very empowering. And I think it's something we need to do more of in modern medicine.
True. Also, in your literature, you talk about the fact that patients will go to the doctor expecting like TLC, but the doctor needs to make sure that their medical issues are being dealt with, and TLC isn't really, that tender loving care that they want isn't sort of in that 10-minute interview, is it? It's not available, is it?
Yeah,
like,
it can be,
would you mind sort of talking about that a little bit?
You can be tender and loving and caring in 10 minutes, but it's a lot harder. Those short consultations and
that's right.
It doesn't give the time to go into things in more depth, a deeper understanding, greater self-awareness. And so that's one thing that our system has tended to do poorly is it just becomes very transactional and here's the script for this and here's the script for that. But it takes more time. It takes more effort for a person to learn how to self-manage a lot of these things in conjunction with good healthcare. It requires a different kind of medicine, which is not a matter of neglecting the best of modern medicine has to offer, biomedical knowledge, etc., because you need that, but we need to realise the human side of things matter as much. If we just think, treating chronic pain, it's just a physical condition, without understanding the mental, emotional, even the spiritual or existential side of things, if those are issues that are not being addressed, it can keep expressing itself again and again in physical symptoms. But unless the deeper issues are addressed, then not going to get a good long-term solution. So, and one of the things that doesn't help is sometimes, if you're thinking, the mind affects the body, as it does. It's not about saying to a person it's all in the mind. It's just all in your mind. It's kind of the person's experiencing what they're experiencing. And if you're interested in mind-body medicine, it's not just assuming everything's just coming back to the mind. It's just about stress. You want to be sure that, it's not, a serious medical condition, that their tiredness is not related to anemia, that they're feeling on edge all the time is not related to their thyroid problem. So you've got to make sure you exclude other things before.
But I want to say on record that every condition, every painful condition, from cancer to arthritis to MS, can all benefit from mind-body medicine. I mean, this is we're talking about a brain that controls your immune system and your thoughts on this is superficial, but control your brain. And so you can control your outcome of your chemical reaction and the way that this is just so, I'm not saying, of course, there's serious things, but everybody and anybody can benefit from this work.
Yes. Somebody turns up and they've had a heart attack and, or at risk of having a heart attack and so on. And you've got to do all of the medical things. You've got to look at their risk factors and so on.
Exactly.
But within 2 hours of a person getting very, very angry, they're about 9 times more likely to have a heart attack in the next 2 hours than somebody who's got the same physical condition but doesn't get angry. And, so it's like, yes, do all the physical medical things, but the mind, our person's, anger, how they're, using their attention, all of this, the mind is there all the time. So it's direct effect on what happens in the body, the immune system, even down to the genetics. But it's also the indirect effects, because it's the mind that decides what we eat. decides whether we exercise or not. It decides, all sorts of things. So it's the indirect effects, because if the mind's not making good decisions, then we're not going to get a good health outcome either. So the direct effects on the body, but also the indirect effects in terms of affecting behaviour.
In ISTDP, we call it a punishing superego. And that's what the mind is doing, isn't it? It's punishing us for some, something we've done in the past or whatever, or not done. And then we need to punish ourselves, and the mind does a good job for it, doesn't it? Yeah.
Can do.
Yeah.
I think ultimately, underneath all, we wish ourselves well. But no.
That's right. But it's only a tiny smidgen. But the punishing part is huge. Yeah.
Can be. Yeah. And this is one of the interesting things, and when people learn mindfulness, for example, and start to practice it regularly, is that the person starts to notice more of the internal conversations they're having with themselves, like the endless self-criticism or the judging that's going on in the background. And the person may not have really noticed how much it goes on and how much attention it draws. And that's a part of self-awareness, to notice that that's where the attention's going again. And if the person develops awareness, rather than being irritated over what they're noticing, is like being encouraged. Oh, now I'm noticing. Oh, that's and when I notice, I have an ability to choose. Is that where I want my attention to be? Or would I like to give my attention to something else, like my life, like the people I'm with, the things that I'm doing, which tends to be a far better choice than the attention being unconsciously and habitually drawn to endless self-criticism and judging others, etc. And none of that gets us very far, I don't think.
No, but it's habitual, isn't it? So, yeah. This is a lovely conversation. I'm wanting to join again the compassion idea. Could you, as we finish up in our time, could we just sort of draw that compassion again into the conversation? Because we can't have one without the other, as far as I can see. So can we draw that back so that our audience can actually get a grip on what we're talking about? This compassion idea, weren't there researchers done on monks and nuns and things that do meditation all the time, and their vasovagal system was sort of in homeostasis? The other thing is, when you were talking, I was also thinking about the fact that patients will give themselves 5 minutes to do this, but it's actually an hour or half an hour, and they need to titrate it up so that they can handle it. Would you mind sharing that with us? Because I know that's what you do with patients when you're talking to them directly.
Yes. Well, establishing a regular practice of mindfulness or any form of meditation for that really does take a little bit of time. Often just starting with a bit and establishing it as a regular practice and building up the time can be very, very helpful. And when somebody says, "Oh, I tried mindfulness, it didn't work for me," that's like saying, "I tried to play the piano once, but I couldn't do it, so I gave up." And you kind of,
good analogy.
we kind of think, no, wait a sec. If you want to play the piano, you want to play Mozart's 21st Piano Sonata or something, you have to learn your scales and you have to practice. And we know we have to put in hours and hours and hours. And say, well, of course. But we think, I'm just going to step in and, try and get mindfulness right the first time, step up on a, golf course and get out the one wood and think I'm going to hit it 250 metres right down the middle. And no, I tried golf once, it didn't work for me. So we do need to realise that this skill takes time. And we need to understand that's a part of the process. We might make more or less progress. But coming back to the compassion bit, in learning anything about ourselves, about the world, in being able to remedy things that we may not like about ourselves or others, helping others, compassion is really is central. And what we tend to notice is criticism and judgment, and that the mind's anything but compassionate to us, to others. And so cultivating this attitude of compassion is central to mindfulness. It's implicit just in the most basic mindfulness practices of the body scan or attention to the breathing, but it can be made explicit. Matthew Ricard, for example, is probably the best known person in the world working in this area. And of course, Shannon Harvey has done, he's one of the people on the documentary, mindfully. But this cultivation of compassion is very crucial so that we can notice the things, even the things we don't like about ourselves or about others. But we can start to notice them and understand them better. We can start to look a little bit more closely and see the causes of things. We can understand what's going on behind. If we just see and criticize, then we stop looking, we stop noticing, we stop learning, and we just keep entrenched the very thing that we're criticizing. So it just keeps on recurring. So this cultivation of compassion, there's a lot of interesting work going on now too between the difference between empathy and compassion. And so when we notice something, like for somebody else who's experiencing pain or discomfort, we experience empathy. And that's a good first step. It shows that we're paying attention, that we're human, kind of thing. But it either goes into empathic distress, oh no, and where we get stressed by their distress, or it goes into compassion. With empathic distress, the person who's experiencing the distress has got their stress areas lit up, but the person who's observing somebody who's distressed and getting distressed by it has got their stress areas of the brain lit up as well. So areas of the brain associated with very uncomfortable emotions. And then in order to help the person quick, I've got to do something to make them all right so I can feel okay again. But all of a sudden it's inward turning and it's about us. It's not actually about the other person. Whereas if a person is able to experience the empathy, but to move towards compassion means keeping the attention out and open on the person who's experiencing it, and just nothing but goodwill as a foundation upon which to act if we are able to act. So the sort of the compassion associated with the readiness to help or support if we can. And what happens there is that areas of the brain associated with positive emotions are lit up. If we're experiencing empathic distress a lot, distress by others' distress, then it can lead to carer fatigue or carer burnout or empathic burnout. But if we can cultivate compassion, that does not lead to burnout. And so people are really expert in the area these days say we should stop using a term like compassion burnout or compassion fatigue. That's not what happens with compassion. That's what happens with empathic stress.
Wow.
But just come back to if we cultivate compassion, including over the things we don't like about ourselves, self-compassion, or about others, but just will us ourselves and others well, then we can learn and we can grow and we can overcome some of the stress we get caught into it.
Most people practice self-compassion. We had a doctor of ISTDP, a wonderful Dr. Patricia Coughlin, and she said right out on the live show, we treat animals with compassion. We treat babies with compassion. We know how to be self-compassionate. We've done that. So that's how you be compassionate to yourself, how you would treat a child. And like, whoa, it can be that simple, not to underestimate anyone's, because we're highly intellectual people. We got a little bit too intellectual and away from our heart. So we think about that it can be done today, in a minute. We're compassionate all the time to others. So that might explain a little bit what you're saying, Rose.
It's not always that easy though, because depending on how we've been reared, we don't know how to actually, that fear comes up when we see someone else in pain or in trouble, and it becomes about ourselves somehow and our inability to cope, as you said. So it's another step back to actually be able to be self-compassionate or open to your own care. So
it's true.
The point
I'm a
which
midwife, so I'm into
the point
into
from which we
newborns.
really matters quite a lot, because if we're totally caught up in our own stuff, then we don't. Self-compassion's a lot harder. But you know, like, but if we're able to stand back a step or two and just observe, and so there we are, we're having a wave of fear or anxiety, rather than, oh no, that's terrible, make it go away, what's wrong with me, I can't stand myself. It's like if we're able to observe, like in that kind of more impartial, I think you use the term drone, Rose, but you know, that sort of just noticing. Then all of a sudden we just say, here's a human being having a human moment. It's okay.
That's right.
Okay to be human. Oh, look, there's some anxiety being experienced. It's okay. Yeah. So we can soften attitude to it, and it can be absolutely a game changer in especially in very difficult moments.
Beautiful.
Yeah.
Beautiful.
Yeah. Well, Craig, thank you so much. Dr. Hassad has got another appointment very shortly, so we need to shorten our talk tonight or today. And
Rose and I are so
thank you
privileged.
so much.
We're so privileged to meet some amazing. Rose and I are so privileged. We get off the show and we're like, we're so blessed to meet these amazing people and have this, 40 to 50 minutes with you. And it'll be on our YouTube, and people write us and they comment. So this will go further. This discussion is not over yet, Dr. Hassad. Thank you so much for your time and your offering of such amazing information.
Thank you. It's been a pleasure. Thank you for the work you do.
Okay. Before you leave, would you speak about your book, please, so that anyone, and Tova can write it in on the side there, and then anyone who wants to get it can
I'm going to put it up for, is it on Amazon.com, I think?
Oh, that's where I got the picture from. But
yeah, so
I think Book Depository has it as well.
Yeah, so Mindfulness for Life. So that's with Exile Publishing, although it be published with other publishers overseas, but Mindfulness for Life. So that would be the best all-round book on mindfulness and how to apply it in lots of different contexts that we've been talking about today. So that would be a very good place to start. And wonderful. I'll just also, there's a very good free online mindfulness program, Mindfulness for Wellbeing and Peak Performance. That's on the Future Learn platform, and it's free.
I'll post it.
Approximately 500,000 people have done that program over the last few years. So if anybody's interested, you can log on to that and work your way through these mindfulness skills we've been talking about.
Wonderful.
Fantastic. Good.
Great resources.
Well, yes. So hopefully everyone who follows that TMS pattern from Dr. Sano can actually find what Dr. Hassad has said is the way to do it, a way to grasp it, I suppose, because reading it in the book is one thing, but actually getting the gist of what you really need to do, like patience, like holding back the criticism, being aware of the criticism, being aware of the self-criticism, being aware of what your expectations are with other people, and drawing back to your own, what would you call it, compassion, your own empathy. What's the right word? Your own source of energy.
Inner resources.
Yeah,
wonderful.
But there's a nicer word. There's a fuller word, but I can't think of it at the moment. But, like living stream that's in you. Beautiful. That's there, that's been clouded by somatic pain.
Beautiful. Thank you so much. Have a wonderful rest of the afternoon.
Thank you.
Bye. God bless.